so glad to have you with us here on this Thursday. I'm Brooke Hash, and thanks to anyone watching on our free WHAS11 Plus app. The Trump administration is preparing to dissolve the Department of Education. Sources said a draft executive order directs the Education Secretary, Linda McMahon, to facilitate a department closure sometime this week. The Department of Education employs more than 4,000 people and spent $251 billion last year. Trump has said he wants to give education back to the states.
I'd like it to be closed immediately. Look, the Department of Education's a big con job.
It is unclear how Secretary McMahon will close the department, as congressional approval is required to abolish a federal agency. This comes as the Department of Veterans Affairs now plans to lay off some 72,000 workers, 15% of its workforce. The head of the VA issued a memo saying he was working with DOJ to aggressively restructure the agency and aims to revert to its 2019-era staffing levels. Well, the changes are worrisome for a lot of our veteran groups here at home. Alex Dieter and Levi Hammer explain.
This is a territory we are charging to with no map.
The federal government announced plans to cut 80,000 employees from the Department of Veterans Affairs. Stephen Gardner with Veterans for Peace is one of 40,000 veterans living in Louisville.
No one knows how many of those people might lose their jobs. However, 100% of them are now anxious.
The announcement comes as part of DOJ's latest federal cuts. VA Secretary Doug Collins posted a video to social media following the announcement.
Now, we regret anyone who loses their job, and it's extraordinarily difficult for me, especially as a VA leader, and your secretary to make these types of decisions. But the federal government does not exist to employ people. It exists to serve people. In
a city where a brand new VA medical center is being built, Louisville Congressman Morgan McGarvey is pushing for more transparency on the cuts from DOJ. And for you being on the Veterans Committee, what are the next steps from that standpoint?
We are sending letters. We're asking who's doing this. Who is the DOJ person responsible for doing this? What is their title? Do they know anything about how to run the VA?
Another concern for veterans is what will happen to their benefits.
We're going to accomplish this without making cuts to health care or benefits.
Even if people don't lose benefits technically, if they have a harder time accessing them, veterans can be a tough population to access. Once you get them to accept something as a matter of trust, and that trust is broken, it can be very difficult to reach them again.
An internal memo told VA staff to prepare for an agency-wide reorganization in August. Alex Dieter, WHAS 11 on your side.
The VA reached its highest level of service ever last year, with over 9 million enrollees and delivering more than 127 million health care appointments. Well, here as we get into the lunch hour in the 12 o'clock hour here on your Thursday, Mallory, we had that snow overnight. I saw a little bit of it sticking to like rooftops,
right?
And then by this morning it was gone.
Yeah, it was gone. Some people had a coating of ice maybe on their car that they had to scrape off. But at this point, we are back above freezing. Temperatures are in the mid to upper 30s, and we're starting to see a few peaks of sunshine from our First Savings Bank U of L health camera from over in Jeffersonville. We'll continue to see more sunshine as the day goes on. Those feel like temperatures, though, still in the 20s in many spots because it is another breezy day. We're not dealing with that wind advisory today, so thankfully no wind gusts 40 to 55 miles per hour, but we are still dealing with wind gusts between about 20 to 25 miles per hour. So that will continue to give us a wind chill throughout the course of the day. Your Max HD satellite and radar, though, we like to see this clouds clearing from west to east, so expect to see more sunshine once again over the next few hours. Temperatures, unfortunately, not warming up all too much. We're talking highs topping out in the mid to upper 40s this afternoon, staying mostly clear through this evening, and then clouds will gradually increase once again overnight with temperatures dropping down to the 30s. But you can see your high temperatures across Kentuckiana today staying below that average in the low to mid 50s for this time of year. And we are expecting breezy and clearing conditions to continue throughout the day. Those winds will back off later on this evening and into tonight. Now, looking ahead to Friday, we do have some light rain chances returning to the forecast, especially late into Friday night as well. But then drier conditions this weekend. We warm up next week with some 70s in that 7-day forecast. We'll talk more about that coming up shortly.
TARC is rolling out phase 2 of its 2025 plan. The Transit Authority cut routes earlier this year and now wants to redesign its rider membership plans. TARC hopes to pivot to offer long and short-term plans for riders. The limited plan would offer reduced services for a lower price, while the enhanced plan would offer more routes with better access to jobs. It would also provide service to every JCPS magnet school that lost bus services this year. If things go well, TARC says it would like to add a JCPS plan that goes to every single JCPS high school.
Let me be clear, though. We do not want to replace yellow buses. Yellow buses are a vital part of kids' education and getting kids to school. But what we believe we have here is two options that provide a safety net to kids and parents as an initial step towards solving some of the transportation needs in our community that we're going to be facing in the years to come.
TARC said the limited plan can run for the next decade without additional investment, while the enhanced plan can run for 5 more years until it will need more support. Today, Governor Andy Beshear will join state health officials to mark 5 years since Kentucky's first confirmed COVID case and honor the lives of more than 20,000 Kentuckians who died due to the virus. While we know COVID is much more manageable now, it's not gone and it is still serious. Our Jim Stratman sat down with an infectious disease specialist from Norton to discuss where we are today.
We are announcing that Kentucky has its first confirmed case of the coronavirus.
A once-in-a-generation disease lands in the Commonwealth.
Many people thought it would be flu, not a coronavirus.
A pandemic, the likes of which we hadn't seen since the Spanish flu in the early 1900s.
There was always maybe this thought that, okay, but not now. Maybe not in my lifetime. Not for a while. Yes, it can happen. Yes, we need to be prepared.
COVID-19 spread into America in January 2020 with the first reported case in Washington state. Within weeks, on March 6th, came the first case in Kentucky. Dr. Chris Bryant is an epidemiologist at Norton Children's Hospital and serves as Associate Medical Director for the Department of Public Health and Wellness. She says by the time the first Kentucky case was confirmed, she and her team were already making plans for the inevitable.
We were looking for cases, we were thinking about it, we were testing people, and we were preparing. When the first stories came out of China about people having an unusual viral illness, did I think it would turn into a worldwide pandemic? No.
Despite the preparation, the pandemic hit, and hit hard. Between March 2020 and July of 2024, more than 1.7 million Kentuckians were infected with COVID-19. Dr. Bryant says the pandemic put a spotlight on public health and how they work, which isn't always straightforward.
Over the course of the pandemic, we locally, public health officials across the U.S. and across the world had to make decisions with sometimes limited data, and then we would learn more, and we would need to modify those decisions to better protect people.
Flash forward to 2025, and the threat of COVID-19 is not what it was, despite the discoveries of new variants. Many people have baseline immunity, vaccines that help protect against serious illness, and procedures in place to help prevent the spread. While no one can predict when the next viral pandemic could happen, this generation has now been there before.
Do you think we're more prepared today to handle an outbreak of a novel kind of virus as opposed to 5 years ago?
Oh, I think so.
Reporting in Louisville, Jim Stratman, WHAS11, on your side.
Dr. Bryant said the COVID vaccine is updated for current variants, and just like the flu shot, it's effective at preventing severe disease and death. Today's ceremony with the governor will start with a chiming of the bells. He asked Kentuckians to do that every morning during the pandemic to support those who were feeling alone. The ceremony begins at 3 o'clock this afternoon at the state capitol.